Good morning, everyone. Welcome to the Health Breakdown today. I want to bring your attention to a serious and often overlooked health risk. Certain commonly prescribed medications that may increase your risk of a heart attack. Yes, medications are designed to heal, relieve pain, and improve quality of life. But like any powerful tool, they come with risk, some of which can be life-threatening if not properly understood. That's why it's crucial to be aware, to ask questions, and to stay informed. So let's dive right in. Here are 5 medications that research has shown may significantly increase your risk of a heart attack, especially when taken without proper supervision or in combination with other risk factors. Certain common medications, like NSAIDs, diabetes drugs, and decongestants, can significantly increase the risk of heart attacks, and this risk is often underestimated by patients and even some healthcare providers. These drugs are widely used for managing everyday health issues such as pain, inflammation, allergies, congestion, and blood sugar levels. Because many of them are available over the counter or are prescribed for chronic conditions, people tend to view them as safe or harmless. However, mounting evidence suggests that when taken over extended periods or in high doses, or when used by individuals with underlying heart conditions, these medications can pose a real threat to cardiovascular health. NSAIDs, or nonsteroidal anti-inflammatory drugs, are among the most frequently used medications worldwide. Drugs like Ibuprofen and Naproxen fall into this category and are often used to relieve headaches, muscle pain, arthritis, and other inflammatory conditions. Although they are effective for these purposes, long-term or high-dose use can lead to fluid retention, increased blood pressure, and a heightened risk of blood clots. All of these factors contribute to strain on the cardiovascular system, increasing the likelihood of a heart attack. Studies have found that the risk can rise substantially, even within a week of regular NSAID use in some individuals, especially those with pre-existing heart disease or hypertension. Similarly, certain diabetes medications, particularly older ones in the thiazolide class such as rosiglitazone, have been associated with higher rates of heart attacks and heart failure. While managing blood sugar is essential for diabetics to prevent complications, the cardiovascular side effects of some medications used for this purpose can be dangerous. This presents a difficult trade-off, especially for older adults or those who already have a history of heart issues. Although newer drugs have entered the market with better safety profiles, some of the older options are still in use, either due to cost considerations or availability. Patients on these medications need to be closely monitored for any cardiovascular symptoms. Decongestants, especially those containing pseudoephedrine or phenylephrine, are commonly used to relieve nasal congestion caused by colds, allergies, or sinus infections. These compounds work by narrowing the blood vessels in the nasal passages, which reduces swelling and congestion. However, they can also cause widespread vasoconstriction, which raises blood pressure and forces the heart to work harder. For people with existing cardiovascular problems or those at risk, this added strain can increase the chances of a heart attack, particularly if the medication is taken frequently or in large doses. In summary, while medications like NSAIDs, diabetes drugs, and decongestants are useful and sometimes necessary, they are not without serious risks, especially for the heart. Being informed about these potential dangers is crucial. Patients should not stop taking any medication without consulting their doctor, but they should engage in active discussions about safer alternatives, dosage adjustments, and regular health monitoring. Understanding the hidden risks behind common drugs can ultimately save lives and prevent devastating cardiovascular events. NSAIDs, or nonsteroidal anti-inflammatory drugs, such as ibuprofen and naproxen, are among the most commonly used medications worldwide. They are frequently taken to relieve pain, reduce fever, and manage inflammation associated with conditions like arthritis, headaches, menstrual cramps, and muscle injuries. Because many NSAIDs are available over the counter and have been used for decades, they are often perceived as completely safe when used as directed. However, growing research has shown that these medications, especially when taken in high doses or over extended periods, can significantly increase the risk of heart attack, stroke, and other cardiovascular problems. Ibuprofen and naproxen work by blocking enzymes called cyclooxygenase 1-COX1 and cyclooxygenase 2-COX2, which are responsible for producing prostaglandins, chemicals that promote inflammation, pain, and fever. While this inhibition helps reduce symptoms, it also interferes with the body's ability to maintain proper function of blood vessels and kidney function. The result can be an increase in blood pressure, fluid retention, and changes in blood clotting. All of these effects can place extra strain on the heart and blood vessels, especially in individuals who already have underlying cardiovascular conditions. Numerous studies have confirmed the link between NSAID use and cardiovascular risk. For example, research has shown that people who take high doses of NSAIDs regularly are at a significantly higher risk of experiencing a heart attack compared to non-users. Even short-term use, just a few days, can raise the risk, particularly in people with high blood pressure, existing heart disease, or other cardiovascular risk factors such as smoking or diabetes. Naproxen, while sometimes considered slightly less risky than ibuprofen or other NSAIDs, is not entirely free from cardiovascular concerns. The overall consensus is that all NSAIDs carry some degree of heart risk, and the risk increases with higher doses and longer duration of use. Another concerning aspect is the widespread availability of NSAIDs. Because they can be purchased without a prescription, many people use them frequently without fully understanding the potential side effects or consulting a healthcare professional. This can lead to unintentional overuse, especially when people combine different medications that may all contain NSAIDs, such as cold medicines, flu remedies, or multi-symptom pain relievers. The cumulative effect can be dangerous, particularly for older adults who are more vulnerable to heart complications and may already be taking multiple medications that interact negatively with NSAIDs. For those who rely on NSAIDs for chronic pain or inflammation, it is important to speak with a healthcare provider about safer options, such as physical therapy, alternative pain relievers, or medications with a lower cardiovascular risk profile. In some cases, using the lowest effective dose for the shortest possible time can help minimize risk. Ultimately, while NSAIDs like ibuprofen and naproxen are effective and convenient, they must be used with caution. Being aware of their potential impact on heart health is crucial to making informed decisions and protecting long-term well-being. Medications for diabetes, cold symptoms, antipsychotics, and hormone replacement therapy are widely used to manage a variety of health conditions, many of which are chronic or recurring. While these drugs are often essential for controlling symptoms and improving quality of life, they are not without risks, particularly to heart health. Increasingly, research has shown that these medications can significantly raise the risk of heart attack and other cardiovascular issues, especially when used over the long term or in individuals who already have underlying heart conditions. In the case of diabetes, managing blood sugar is critical to preventing complications such as nerve damage, kidney failure, and vision problems. However, some diabetes medications, particularly older ones in the thiazolidine class, like rosiglitazone, have been linked to an increased risk of heart attacks and heart failure. These drugs work by increasing insulin sensitivity, but they can also lead to fluid retention, weight gain, and changes in cholesterol levels, all of which put extra stress on the cardiovascular system. While some of these drugs have been restricted or removed from the market due to safety concerns, others remain in use, particularly in lower-income settings where newer medications may not be affordable. This makes careful monitoring and regular cardiovascular assessments essential for patients taking these drugs. Cold medications, especially those containing decongestants like pseudoephedrine and phenylephrine, are another potential risk. These compounds work by constricting blood vessels in the nasal passages to relieve congestion, but they can also narrow blood vessels throughout the body, leading to increased blood pressure and heart rate. For people with high blood pressure, heart disease, or those at risk of these conditions, the use of decongestants, even for a short period, can be dangerous. The problem is compounded by the easy availability of these medications over the counter, often leading to casual use without consideration of the possible cardiovascular side effects. Antipsychotic medications, especially second-generation drugs like olanzapine and risperidone, are used to treat mental health disorders such as schizophrenia and bipolar disorder. While they are often necessary for managing severe psychiatric symptoms, these drugs are associated with metabolic side effects, including weight gain, high cholesterol, and insulin resistance. These side effects significantly increase the risk of cardiovascular disease over time. Patients with psychiatric conditions are already at a higher risk of heart problems due to lifestyle factors and limited access to consistent health care, so adding medication-induced risks can lead to a dangerous combination. Hormone replacement therapy (HRT), typically prescribed to relieve menopausal symptoms such as hot flashes and osteoporosis, can also increase heart attack risk in certain populations, especially in older women or those with existing cardiovascular risk factors. HRT containing estrogen and progestin has been shown to raise the risk of blood clots, stroke, and heart attacks. While HRT can be beneficial for symptom relief and bone health, it must be prescribed with caution and accompanied by regular cardiovascular evaluations. In conclusion, while these medications serve important roles in managing chronic and acute conditions, they require careful use and regular monitoring due to their potential to adversely affect heart health. Patients should regularly review their medications with their doctor, as this simple but critical practice can significantly reduce the risk of serious side effects, drug interactions, and long-term health complications, including heart attacks. As individuals age or develop new medical conditions, their bodies respond differently to medications, and drugs that were once safe or necessary may become less effective or even harmful. Regular medication reviews ensure that treatments are still appropriate, up-to-date, and tailored to a patient's current health status and risk factors. Many people, especially those managing chronic conditions such as diabetes, high blood pressure, or arthritis, take multiple medications daily. This is known as polypharmacy, and while it may be necessary, it also increases the risk of harmful drug interactions and side effects. Some combinations of medications can amplify the risk of cardiovascular events, especially if they affect blood pressure, cholesterol levels, or kidney function. By reviewing all current prescriptions, over-the-counter drugs, and even supplements with their doctor, patients can identify any problematic interactions early and take steps to reduce risk. Medication reviews are especially important when patients are taking drugs known to have potential cardiovascular side effects, such as NSAIDs, certain diabetes medications, decongestants, antipsychotics, and hormone replacement therapies. A doctor can help weigh the benefits of continuing these medications against their risks, particularly if safer alternatives exist. For example, in some cases, a non-drug approach such as lifestyle changes, physical therapy, or a lower-risk medication may be just as effective without the added strain on the heart. Another critical reason for regular reviews is that medical guidelines and drug safety data are constantly evolving. A drug that was widely prescribed a decade ago may now be known to have serious risks, or a newer and safer alternative may be available. Patients who do not routinely follow up with their doctor may miss these updates and continue taking outdated medications that are no longer considered the best option. Doctors stay informed about the latest research and can help ensure patients are receiving the most current and effective treatments. In addition, changes in a person's weight, kidney or liver function, and lifestyle habits can all influence how medications affect the body. If someone has lost or gained a significant amount of weight, started or stopped smoking, or developed a new health condition, their medication needs may change. By reviewing medications regularly, healthcare providers can make necessary adjustments to dosages or discontinue medications that are no longer appropriate. For patients, regular medication reviews offer peace of mind. They provide an opportunity to ask questions, clarify how and when to take each drug, and express any concerns about side effects or costs. This open communication fosters a more collaborative relationship between patient and doctor, leading to better health outcomes. Ultimately, reviewing medications is not just about avoiding harm, it's about ensuring that every drug a person takes is truly helping them. It is a powerful form of preventive care that can protect the heart, improve quality of life, and potentially save lives. The goal is awareness, not fear. When discussing the potential risks associated with medications, especially those that may increase the chance of a heart attack, it is important to approach the subject with a clear understanding and balanced perspective. Raising awareness means equipping people with the knowledge they need to make informed decisions about their health. It is not about scaring individuals into avoiding medications altogether, but rather helping them use these tools more wisely and safely. Many people rely on medications every day to manage chronic conditions, relieve pain, or improve quality of life. These drugs often play a critical role in helping people function and feel better. However, just like any powerful medical intervention, they come with risks that must be considered. By becoming more aware of these risks, such as increased blood pressure, fluid retention, or dangerous drug interactions, patients and caregivers can take proactive steps to protect heart health and overall well-being. For instance, knowing that certain painkillers or decongestants may raise blood pressure can encourage someone to check with a doctor before using them if they already have hypertension. Understanding that some diabetes or antipsychotic medications might affect weight and cholesterol levels could motivate patients to monitor their heart health more closely or explore safer treatment options. These actions are rooted in awareness and responsibility, not fear. Fear, on the other hand, can be counterproductive. It may cause people to stop taking medications abruptly or avoid them entirely without proper medical guidance, potentially worsening the very conditions the drugs are meant to treat. For example, a person with diabetes who fears a heart attack risk might stop taking their prescribed medication, which could lead to uncontrolled blood sugar and serious complications. Or someone with depression might discontinue antipsychotics or mood stabilizers, putting their mental health and safety at risk. This is why it's crucial to emphasize understanding over alarm. Healthcare decisions should be made in partnership with qualified professionals. By staying informed, asking questions, and discussing concerns with doctors or pharmacists, patients can participate actively in their care. The goal is to weigh the risks and benefits of each treatment and to adjust plans when necessary, not to reject medication outright, but to use it in the safest and most effective way possible. Moreover, awareness encourages a broader conversation about preventive care. If patients know that certain medications can affect the heart, they might be more inclined to adopt heart-healthy habits, such as eating a balanced diet, exercising regularly, avoiding smoking, and managing stress. These lifestyle changes, combined with thoughtful medication management, can greatly reduce the risk of heart problems. In the end, awareness is empowering. It leads to smarter choices, healthier outcomes, and stronger communication between patients and healthcare providers. Fear shuts down dialogue and prevents action. Awareness opens the door to better health. By staying informed and asking the right questions, we can protect ourselves not only from the risks of medications, but from the greater risk of inaction.